Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARS, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPARS partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARS, which is touted as one of the best natural ways of solving serious health problems.
PPARS stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARS, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARS is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARS is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Napansin ng pedyan niya na maputla compared noong bagong silang kasi monthly na nagpapa-follow up kami. Maputla at saka medyo distended na yung kanyang abdomen. From then, doon kami nag-start ng workup like blood test, ultrasound, hanggang ma-CT scan and ma-work up sa hospital. Doon na na-diagnose na meron siyang stage 3 na yung kanyang tumor sa liver. When she started taking PPARS noong September 25, we decided na i-try at i-monitor siya within a month. So, within a month, after 1 month, October 25, nagpa-blood test and ultrasound kami. And we really thank God na there is a big improvement. For me, it's really a blessing yung PPARS because yung dating alpha-fetoprotein niya na tumor marker ng liver cancer, which is 65, it went down to 14. So, almost 4 times yung kanyang binaba na from 65 to 14. At ang kanyang ultrasound din, lumiit din yung kanyang lesion. Before siya nag-take ng PPARS, it was 3.6 by 4 by 3.5 centimeters. After 1 month lang, malaki din para sa amin yung binaba niya na naging 3.1 by 2.8 by 2.7. So almost 1 lahat yung 1 centimeter, yung 1 centimeter kahit 1 centimeter lang yun. malaki na yun na pagbabago kasi 1 month pa naman eh. So, aside from sa pag-decrease ng kanyang lesion, meron din kasing nakitang nodule sa kanyang spleen that measures 1.7 by 1.9 by 2 centimeters. After 1 month na sa pag-ultrasound niya, it's miracle for us because it's totally gone. It totally disappeared. So we are thankful, forever thankful for leading us to PPARS kasi we believe na ginamit ni Lord yung PPARS to help us na hindi mag-undergo ng surgery yung baby namin.
Talagang pinagdidiin ako kay Dr. Jansen, ayoko, PPARS na lang pero ayoko ng chemo. Sabi niya, mas maganda raw na mag-chemo, wag ako matakot kasi nandiyan naman si PPARS na tutulong para ma-restore yung good cell. Nung nagte-take ako ng PPARS, 1 month, nakatayo na ako ng walang hawak. Nakakapagluto na ako ngayon, nakakapag-shopping. At isa pa, yung side effect na sinabi nilang maluluks, hindi nangyari sa akin. Hindi ako
CA markers.
Mataas siya. Then, nung after 3 months, nung pag-take ko ng Simply Nature, doon, naging normal na siya until now. Kahit si Dr. Johan na gulat siya kasi biglang normal agad in just 3 months, nag-normal agad yung CEA ko. 1 year and 5 months. Cancer-free. Dapat may food supplements kayo. Like Simply Nature na proven and tested ko na. Talagang hindi ako pwedeng mawala ng Simply Nature na yan.
2019, I was being diagnosed a cancer of my uterus. So I was shocked. Sabi ko, bakit nagkaroon ako ng ganito? Samantalang hindi ako mahilig sa pagkain. I'm sorry, basura. Started the tablet and then the powder. Tinry ko din yung yung tawag dito.
Gel?
Yeah, yung gel. Yes. It's really good. After 2 months ng aking therapy and taking PPARS, sabi ni doktora, pagpa-laboratory ka na. So, nung nagpa-laboratory na ako, praise God, 2 weeks ago or 3 weeks ago, lahat normal. To God be the glory. Salamat sa Diyos. Sa 2 months ko po ng aking pag-take ng PPARS, ako po ay cancer-free.
So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARS. Okay, because Simply Nature PPARS protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system, the integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So, those are some of the benefits. So, actually, combining Simply Nature PPARS and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
Hi everyone, welcome to another episode of Simply Healed. We're so glad that you're joining us again on our regular slot on Thursday, the longest running cancer discussion forum program online right now.
Yep.
So Doc Jansen, good to see you again.
Yeah, hello Sean, hello everyone. Glad to be here again. Tonight, we're going to be discussing all about cervical cancer. Okay? So for cervical cancer, it's the second leading cause of cancer among women here in the Philippines. Cervical cancer is actually estimated to occur in about 7,800 women every year. And these are new cases, okay?
Wow.
And then also, in terms of cervical cancer deaths, it's estimated to be around 3,800 every year, okay? So this is actually a very common cancer among women.
But
okay?
it's also a very treatable cancer
it's
if you detect it
early. It's very treatable if you detect it early, but the mortality rate is also high if it becomes advanced already. Okay.
So Doc, what is cervical cancer? Maybe
Alright.
a simple biology lesson for all of us.
Okay. So just to be clear, where the cervix is. Okay. So this is the female reproductive organ. So the cervix is found here. Okay. So it is actually at the collar of the uterus. Okay. So this is what cervix looks like. So on the left is the normal cervix. So as you can see, the cervix is actually round in shape. It's like a donut, no? So it's like a donut. Then at the center, that is the opening. If you go inside that, that's going to be entering the uterus already. Okay, so that is what the cervix looks like. Now, this is the normal one. Now, this can change in appearance when a woman gets pregnant. Okay, but if a woman gets cancer, this is what it will look like. Okay, on the right. So here on the right, you can see a fungating mass. Okay, a fungating tumor. You cannot actually see the cervix already. It's already very different. Okay, so
is it painful?
Usually yes, but the pain is not that. It's not excruciating.
Not like bone cancer.
Yeah, it's not like bone cancer. There is just a discomfort that you can feel, which one of the symptoms.
So that makes it even more dangerous because looking at the picture, it's not a good condition, but you don't really feel
anything. By the time that you feel symptoms with cervical cancer, usually it will already be in an advanced stage. Okay, so here are the symptoms. Alright, so as you can see in the previous picture, you have bleeding. Okay, the cervix is actually bleeding, so you will have spottings, intermenstrual bleeding or bleeding in between your menstruation. You can also bleed more heavily when you are on your period. Okay, you can have an increased vaginal discharge, which has a fishy or a foul odor. Okay, for cervical cancer, there is a very distinct smell that when you smell that odor, it is almost always cervical cancer.
Wow.
Yeah, so next is unexplained persistent or pelvic or back pain, okay, especially in the lower back. You can also feel that, and pain during intercourse. Tension.
What should they do next if they have this like persistent pelvic back pain and then pain during intercourse? What's the thing that they should do?
Okay, you should go to your doctor immediately. Okay, especially to your OBs. So when you go to your OBs for a consult, explain the symptoms. Now, these symptoms, usually to diagnose or to suspect cervical cancer, it should be a combination of these symptoms. for the risk factors, what risk factors increases your chance to develop cervical cancer? So we know that the most common cause of cervical cancer is HPV infection.
Which
HPV
can be vaccinated.
Yeah, you can get vaccinated for this. So watch our previous video to know to know about this. Okay, HPV infection. You have different types of viruses of HPV. You have the low risk and the high risk. It's the high risk HPV viruses that you should get vaccinated for, and this is the most common reason why you develop cervical cancer. Now, what are the risk factors? HPV or human papillomavirus is transmitted mainly through sexual activity. Okay? So if you have multiple sexual partners, if you are smoking, why? Smoking because it's just because smoking decreases your immune system, okay? It weakens your immune system, so that's why. Okay? Next is exposure to miscarriage prevention drug called diethylstilbestrol. Now this drug is mainly used way back in the 1950s. It's not used anymore now because it is cancerous. Okay, so
shouldn't be prescribed right now.
Yeah, shouldn't be. Okay, you should not be actually taking this. Okay, but for our grandparents and to some extent our parents who have who lived through the 1940s, 50s. Okay, they might have had the exposure to this. Okay, so you have to be very, very wary about that.
But perhaps let's just go through screening and diagnostics.
So
how would they go about screening and diagnosis?
Okay, so how do you screen for cervical cancer? If you want early detection, it's pap smear. Pap smear can be done once every 3 years for sexually active women or who have had a sexual encounter before.
Doc, you mentioned once every 3 years. So important question right now is, how fast is cervical cancer? I mean, will it grow very rapidly? That if you are just unlucky that you're in between.
Okay.
So how fast is cervical cancer?
No, usually cervical cancer takes years to develop. Okay, so it's also a slow growing cancer early on. But if nothing is done, it becomes in an advanced stage, then it can grow very fast.
So pap smear is a good strategy.
It's a good strategy.
Ladies, don't miss your pap smear testing, especially if you have all those
risk
common
factors.
Risk factors.
Okay, so you know yourself. Okay, so another confirmatory test is HPV DNA test, which detects the HPV virus itself. Okay, which detects the high risk virus for developing cervical cancer. So that is also one of the screenings that you can do. All right, next is biopsy. Biopsy is a confirmatory test. Then imaging studies that you can do is transvaginal sonography. So this can be used as a screening or staging. But when it comes to staging, we have limited information. So because you cannot see the lymph nodes with ultrasound, and you need to see the lymph nodes to properly stage cervical cancer. So next is abdominal or pelvic CT scan, which is the one that is used to stage cervical cancer properly. Okay. Now let's go to the staging. So we have 4 stages. All right. So the first stage is when the tumor is still confined in the cervix.
Wow.
Stage 2, when it invades the uterus. Then stage 3 is when the tumor invades the pelvic wall, lower third of the vagina, if it already involved the lymph nodes, and if you already have a non-functioning kidney. Okay. So lastly, stage 4 is when you have metastasis to the distant organs already, like your bladder, your when I say bladder, your urinary bladder, your rectum, the distant lymph nodes, the more distant ones, like your neck lymph nodes, okay, shoulder lymph nodes, your lungs, your liver, your bone.
So what I saw that was interesting or important to note is that you mentioned that if you have cervical cancer, then kidney functions can get damaged.
Then
can that actually lead to kidney failure while you are fighting cervical cancer?
Yeah, it can lead to kidney failure, especially if you cannot void normally already, and the pressure just builds up. Okay, so it can also happen.
No, I can also imagine. Wouldn't this have a lot of other complications because you have toxins building up in your body? You can't wee and I'm sure many other organs get.
Yes, exactly. Especially if both kidneys are affected, then you will have to go on dialysis.
Doc, what about treatment? How does a person treat cervical cancer?
Primarily on the early stages, cervical cancer can be treated using surgery, and it's really very it's quite easy to do. as well, because you just remove the uterus together, of course, with the cervix. You remove the ovaries, so actually it's you remove everything, no, the whole female reproductive organ. Then the prognosis of patients with this procedure is really good. Okay, because after the surgery, you just have to go on a brachytherapy. Then that's it. Okay, quite simple. But if the cancer already becomes more advanced, then surgery might not be an option already.
Because it's in more than one
Yeah,
location.
it's in more than one location, so it's actually not going to be wise already to do surgery, because even if you remove the tumor there, you have other locations that needs to be treated. Okay, so what we do is to go for a concurrent chemo and radiation therapy. So now, why should it be together? By the term concurrent, chemotherapy and radiation therapy should be administered together. Why is that so? So because for cervix, no, for the cervix is an organ where the cells do not replicate that fast anymore. Okay, so if it's that way, then it won't be as sensitive to radiation. That's why you need something that will stimulate the replication of cells, which is chemotherapy. Okay? So you administer them together so that the radiation therapy will be effective. So now, what is that chemotherapy that is usually given to cervical cancer patients for this purpose? It's cisplatin.
Which is very important.
Yeah.
Later,
okay?
mention why.
Yeah,
Wow.
so cisplatin, as all of you know, it's both cytotoxic, and in this case, by the term cytotoxic, it directly kills cells. It directly kills the cancer cells, both the cancer cell and the healthy cells, okay? But you need this because cisplatin also functions as a radiosensitizer. So a radiosensitizer means it's something to make the radiation more effective. Okay? So it's given together. All right?
What are side effects to watch out for?
Side effects,
when you're going through
yeah,
this chemo?
because this is quite toxic. You can just imagine you just undergoing radiation
Both at the
therapy,
same
and then
time.
it's both at the same time, right?
Wow, that's
So, side effects to watch out for: anemia, fatigue, decreased WBC count, so you'd be more prone to infections.
Which, if you have a damaged kidney,
Yeah, all
it's
the
just
more
going to increase all the risk.
yeah, all the more bad news, no?
Yeah.
Nausea, vomiting because of the cisplatin, dermatitis, dryness of skin because of the radiation, bruising, bleeding because of decreased platelet count, and then UTI. Okay, so those are the side effects that you have to watch out for. Now, why is this so? Especially for anemia, fatigue, decreased WBC count, and the bruising and the bleeding. Okay, why do we have these symptoms? It's because cisplatin it's actually toxic to the bone marrow. Okay,
Wow.
it's these white blood cells, no, your white blood cells, your red blood cells, your platelets, all grow from the bone marrow. Now, if you damage the bone marrow, then naturally your WBC, red blood cells, and your platelet counts will go down. So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARS. Okay, because Simply Nature PPARS protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system, the integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So, those are some of the benefits. So, actually, combining Simply Nature PPARS and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
And we do know that the chemo radiation therapy, though difficult to endure, does work to treat and cure you of cancer. So together with the extract, Simply liquid extract, to work together to minimize all the damage.
Yeah.
This is just good news and good news and good news for all cervical cancer patients. And of course, for those of our viewers who are always very interested in natural, yes, have a consult with Doc Jansen because Simply Nature protocols work very well in lifestyle medicine to provide you a natural approach to treating cancer. But we always talk about chemotherapy and radiation therapy because when cancer reaches the third and especially the fourth stage, time is of an essence. You don't want to stand on a ideological perspective. You don't want to stand that I am natural, I am what? No. I think when you're at fourth stage, you want to say, let me use everything that works.
Right? Use everything that works to increase the quality of life, to extend your lifespan. Okay, because time is more important now than ever.
Yeah, so once that's why for me and Dr. Jansen, we believe in natural too. I mean, that's why Dr. Jansen's a lifestyle medicine doctor, right? Using foods to heal. Yeah, but we do take time to talk always about chemotherapy and radiation therapy because many of our viewers are afraid of them. But please don't misunderstand. Dr. Jansen is vegan, right? He takes purely only vegetables. So of course, we are firm believers of the natural approach. But we have to, for your good, for the good of our listeners, we have to help you not be afraid so that if you really are in late stage cancer, you will use all the best options available to you. All right, so that's why we talk about chemotherapy and radiation therapy so often. So Doc, if we move fast, what is the success rate? And why for late stage cancer we would go to, use such strong therapy like chemotherapy and radiation therapy? What is the survival rates of cervical cancer?
The numbers that you see here, please try to understand how they came up with these numbers. So these numbers are the ones, are the chances, the survival rates in 5 years. So if you first got diagnosed with an early stage or localized cervical cancer, then your survival rate is 92%. Why is it like so? It's because at an early stage, of course, if you know that you have cervical cancer at an early stage, you get treated. Okay? How do they treat early stage cervical cancer? If it's so small, then just a simple biopsy will do.
Wow.
Okay?
And then eat well, lifestyle medicine, make sure you recover.
You survive. Okay? If it is a little bit big already, then do the surgery. Once you're done with the surgery, usually oncos are a little more, in Filipino we call it sigurista. More thorough. They don't want to take chances. They want a more aggressive approach, so they give you radiation therapy. That's why you have a very high survival rate, okay, for a localized cervical cancer. But when it goes regional, right, once it involves the other organs, when surgery is already not an option, then it decreases to 58%. Okay? Especially if you got diagnosed with stage 3, stage 2, stage 3, cervical cancer, then this is what happens, especially stage 3. Now, for distant cervical cancer, metastatic already, then chances is 18% of survival. Okay? So, as you all see, for all cancers, the more advanced it is, when you get diagnosed first, then the prognosis is bad. It will be worse. Okay, so it's very important. Time is of the essence. Try to take action immediately. Okay, do not dilly-dally and try to go doctor hopping. Okay, if you see a good doctor that knows what he's doing, then go for it.
And as we talk about time being the essence, we also noticed that the questions are coming in. I can see some questions are focus on cervical cancer, but there are also other questions coming in general about other types of cancer. And of course, I see a few questions coming in about what foods to take, Doc. So without further ado, let's move to our AMA Ask Me Anything segment.
Good evening, everyone. My name is Sheila, and you are watching another episode of Simply Healed webinar brought to you by Simply Nature. Today's episode is entitled Cervical Cancer, Symptoms and Treatments. I know that you have learned a lot from our two gentlemen tonight. So without further ado, to answer all our questions, I'd like to call on our PPARS expert from Singapore, Mr. Sean Lim, and of course, our lifestyle medicine doctor, Dr. Jansen Calalan. Good evening, Sir Sean, and good evening, Dr. Jansen.
Hey, good evening, Sheila. Good evening, everyone. Thank you for joining us today. A special shout out from our viewer all the way on YouTube from Zambia, Africa. Wow!
We're all around the world already.
Yeah, and
really
our viewership from week to week has been increasing. So thank you everybody for your vote of confidence, for sharing the message. We are the longest running cancer series, right? Running live at least here in Southeast Asia. And we have Dr. Jansen with us to answer all the questions.
Yeah, hello everyone. I hope you learned a lot in today's webinar. Okay, so I already see a lot of questions coming up in the comment section. So yeah, let's start.
All right. Okay. So, starting off with Miss Lilibeth, what are the common causes and symptoms of cervical cancer?
Okay, common the cause. Okay, first question. Okay, the most common cause is HPV or the human papilloma virus. Okay, so it's an infection. Actually, is the one that causes cervical cancer. Okay, that is the most common one. Then the symptoms, usually it's vaginal bleeding. Okay, usually it starts out as a spotting. Then the vaginal discharge is foul smelling. Okay, there's a distinct smell with that. So doctors would know this, healthcare professionals who are dealing with cancer patients would know this. So once the patient comes in the doctor's clinic, immediately the doctor can know a certain smell that the patient might have cervical cancer. Okay, there's a distinct smell with that. I cannot describe the smell, but it smells like a rotting fish.
Wow. Okay.
So you know that the smell is quite strong. Okay, so those are the more common symptoms that we look for. But the more common one is vaginal bleeding or vaginal spotting. Sometimes in between the menstrual period, or you have a strong menstrual period. Okay, during that period of the month. Okay, those are the more common ones.
So Doc, actually for cervical cancer is one of those cancer types that your risk actually goes up if you are sexually active.
Yes.
With multiple partners.
Yes.
And amazingly, the good news is that this is the one cancer that you can actually get a vaccine for. Mm-hmm. So if you have a very active social life, then this is something you should really consider. Yeah. I mean, this is as lethal as HIV. It's a death sentence when you get cancer. So this can be avoided by going for vaccines, especially if you have a very active social life.
Yeah.
Okay. All right. On to our next question coming from Ms. Lydia Cervical. Is there any risk of infection with a chemotherapy or radiation in a negative way?
Again, come again.
If you have chemotherapy, can it result in infection or that means can chemotherapy actually cause you to get an infected wound?
Okay. Only if your immune system really goes down, then it's possible.
Is that why oncologists will be very careful to administer chemo when you have low red blood cell count and white blood cell count?
Yes, actually the chemotherapy will be stopped. Okay. Usually this is what happens. Before you go into chemotherapy, the onco will request a baseline blood test. Okay, so we know where you start at. All right. So let's say, for example, your white blood cell count before you go for chemo is around 7. Okay. Now, once you start chemo, the onco will monitor you every now and then. Now, of course, once you start chemo, your white blood cell count will go down. Probably around 4, sometimes 3.
But why does it go down? Because the chemo drug actually damages.
It damages the bone marrow. It's one of the side effects. Now, the reason why the white blood cell goes down, it's because the white blood cells, the immature white blood cells or the baby white blood cells come from the bone marrow. That is where they mature. Now, if you destroy their nursery, so to speak, okay, then you won't have functioning white blood cells. Your white blood cell count in your blood will decrease. Okay? Now, once that decreases to a certain point, now the onco will have to stop giving the chemotherapy and then inject you with a drug called GM-CSF. Okay, so that is a drug that is given to you to stimulate the stem cells, the white blood cell stem cells inside your bone marrow. Okay? Now the problem there is, although you stimulate the stem cells, but if your bone marrow is so dead, okay, meaning it was so damaged, then the effect really won't have any significant impact. Okay, you have to have the right environment as well. Okay, inside your bone marrow, so that once the onco gives you the GM-CSF, then you have a substantial increase in your white blood cell count. Now the good news is we have a Simply Nature PPARS that can mitigate the bone marrow toxicity, so that even if your white blood cell count goes down, then in let's assume that your immune system really suffers. Once the onco gives you the GM-CSF, then you can see an immediate increase or an immediate improvement in the white blood cell count in the coming days, and you're now ready for your next round of chemotherapy. Okay, so that is one of the wonders of Simply Nature PPARS liquid, especially the liquid form. That's also what I give to my patients who are undergoing chemotherapy and radiation therapy, and they have such side effects. Okay, but so far I haven't seen any patients that who are on the PPAR liquid underwent chemotherapy and suffered an infection. So far, none of them. Although I see, even if they are on Simply Nature PPAR liquid and then they undergo chemotherapy, I still see a decrease in the white blood cell count. But that is just because of the side effects of chemotherapy. But even if I see a decrease, they can immediately recover, so that they're now ready for the next cycle. So the onco wouldn't have to stop giving the chemotherapy.
And Doc, just to support you in this, we have actually patient from Singapore, and they were doing experimental breast cancer chemotherapy drug. The doctor couldn't administer the chemotherapy drug because the patient's red blood cell and white blood cell count was low. So what happened was that the patient took Simply Nature liquid extracts 2 or 3 days before the targeted date for the chemotherapy, and they were able to quickly stimulate the red blood cell count. Just within the few days, that they actually saw an increase. Actually, this is also happens with dengue patients.
That's really
right?
good.
Yeah, so dengue patients, you can see their white blood cell count, the platelet counts drop to almost double digits, very, very low. And literally in 4 hours after taking the liquid extracts, you can see the count multiplying, going back up, starting to increase, and over the next 12 hours, it actually can normalize. So it actually happens quite quickly. It doesn't take weeks or months, literally is hours and days. So this is what we observe, and the good strategy is that to protect yourself from the damage instead of repairing the damage. As a cancer patient, your body is already under stress, so if you have to repair something, it's going to take more energy again. So it's better to just protect yourself. Doc, there's another question related to the one that you just answered. Someone asked if capecitabine, which is a chemotherapy drug, whether it induces bone marrow damage.
Yes, it can.
Yes.
It can. One of the side effects of capecitabine. Capecitabine is an oral chemo drug. I have a number of patients who are on capecitabine, and some of them, a lot of them actually improved with capecitabine, but together with Simply Nature PPARS. Remember this one patient of mine who had breast cancer, who I first saw with breast cancer stage 4, discontinued chemotherapy. She just had one cycle, stopped it. Then I saw her bedridden, in so much pain. I advised her to go back to the onco to receive chemo again. Then I started her with Simply Nature PPAR liquid. Lo and behold, thank God, her weight actually increased. Then she was able to walk again, even went shopping. The chemo drug that the onco gave her is actually capecitabine. Okay.
Wait. So for Perlin Nunes, I would really encourage you to go for a consult if you are not already on our Simply Nature protocols, because we have Doc Jansen has patients that are on the very chemo drug that you're using and did very, very well. So that's good news for you. That's good news.
Mm-hmm.
Alright, thank you, Doc. Thank you, sir. Actually, I just want to let you know, Sir Doc, we did have some few more questions or queries that came in earlier before this webinar that has something to do with PCOS and also myomas. So I guess, a lot of women, and of course, majority of our registrants tonight are actually women. We're very worried if this illnesses or conditions are actually connected with the cervical cancer. So I think yes, Doc.
No, they are not connected at all. PCOS is actually a metabolic disease. Cervical cancer is the root cause of cervical cancer is an infection. Different, okay? But I think it.
But the good news is,
the good news.
The good news is for PCOS, especially for PCOS, actually, there's another doctor who shared during the Prima Life, the conference. Prima is a conference for integrative doctors, right, and medical doctors. He actually did a lot of PCOS patients, and he used Simply Nature soft gel capsules. So didn't have to go to the powder, and he had great results together for the PCOS. And for myomas are basically growths.
Yeah, it's a growth. Myomas,
blood growths, right?
Myomas are actually quite sensitive to estrogen. Usually women develop myomas because of a very high estrogen circulating in their blood. It can be because of the diet. It can also be because of some aberrancies in the metabolism. Okay, so it's still a metabolic disease. Although myomas are benign. They are tumors, yes, but they are benign. There are certain myomas that can convert to cancer, but they are so rare. So they are called leiomyosarcoma. Okay? But leiomyosarcomas are really rare, and usually doctors find out that what the patient has is actually leiomyosarcoma is when they actually already took out the uterus and then they examined the tumor.
So for myoma patients, should they go for surgery to remove?
If you are bleeding so much, yes, you have to, because if you are bleeding so much, that is already life-threatening. The solution to that should be immediate. You have to remove the bleeders. Okay, so
Doc, you did mention that myomas are metabolic in
nature.
Cause.
Yes.
So basically, if anything that regulates the metabolic pathways, would it be of assistance in general?
Yes, it would definitely. Anything that has a metabolic root cause, you have to address that also metabolically. Okay, so how do you do that? Lifestyle, number one. Number two, you have to have products that actually has an effect on the metabolism, like Simply Nature PPARS. So actually, we have a drug for that. PPAR is one of the nuclear receptors that certain drugs acts on, like your pioglitazone. So these drugs are
literally, these are the synthetic versions of what Simply Nature PPARS is.
Yes. So those drugs act on the diabetes. So diabetes is what you all know. It's also metabolic. Okay. So address that metabolically to prevent more myomas coming out and to prevent it from growing big. Okay, but can it shrink it? Depending on the size. If it's too large, might not be able to shrink it anymore. But for those small ones, there's a possibility, yes. But again, it depends on the urgency of your case. If you are bleeding, have it removed. Okay, it would be better for you to have your uterus removed rather than try to toughen it up, because you'll be in and out of the hospital receiving blood transfusions. quality of life will not be good. Okay?
So for patients with myomas, you have the choice of using metabolic drugs that target the PPAR receptors, so you can either choose to use the drugs, or if you want something natural that works the same way, then you can use Simply Nature PPAR products. Whether they be tablets or soft gels, the dosaging will depend on your seriousness, and for that, go for a consult.
Yes.
Thank you, Doc. That's very encouraging. Thank you, Doc. Okay. Another question: is there any foods that can help us prevent cervical cancer, particularly cervical cancer?
Unfortunately, no. It's not the food that is the issue.
It's the virus.
It is the virus. So how do you get the virus? The virus is actually sexually transmitted. So for men, only one woman. Okay, for women, only one man. So loyalty here really
counts.
Good. Yeah, really counts. Okay, and if you are single, I know you really want to mingle. You would really like to mingle, but please practice safe sex. Use a condom. Okay.
And get vaccinated.
Yes, and get vaccinated.
Get vaccinated against this cervical cancer.
Because of course some people actually have does sexual acts as a profession. Okay, we don't judge them, but they would have to practice safe sex. So use a condom. If it's impossible, then get vaccinated. That is the best way to protect yourself. Okay?
Actually, Doc, in today's day and age, you could be very conservative, but you don't know your partner.
Yes, you don't know your partner.
Yeah, your partner could have been a bad boy, good or bad girl turned good, right? So
Previously,
you don't know.
yes.
So their previous history, they carry it into the relationship. So I think for ladies, there is no downside to doing the cervical cancer vaccine. Is there any downsides to it, Doc?
No.
No downsides at all.
Side effect, it's so few. I've actually vaccinated my family members. They didn't complain anything aside from the pain in the arm. Pain on the injection site. I personally gave myself the cervical cancer
but you're
vaccine.
a guy.
But I'm a guy. Yeah, but guys are carriers.
Okay. So you're doing it for your partners.
Yeah, I'm doing it for my future wife.
Yeah.
Although I was not sexually active. Okay, but just for the protection. Okay.
Yeah, Doc is a good guy.
Yes, just for the additional protection. So yeah, even if you are single, you are a virgin, you haven't had any sexual activities before, then it's wise to get to receive the cervical vaccine, cervical cancer vaccine, HPV vaccine. Okay, because for guys it would be penile cancer. So your head down there would have another head. So
and Doc, I was surprised because maybe I'm older. I missed the boat in this, but if you're working for a large multinational corporation, many times getting this cervical cancer vaccine is actually part and parcel of your health benefits. So just check with your company, right? Yeah.
Thank you, sir, and thank you, Doc. Alright, another question. But just before we go to another question, I just want to greet once again our two ladies coming from Malaysia and coming from the Philippines are always watching. And I'd like to say thank you also for sharing our links and our webinars, always our weekly webinars, to your fellow friends and relatives and fellow patients in your hospitals. Thank you so much. And Ms. Cora Gozarate, thank you again for joining us tonight.
Oh, I noticed we have another viewer on YouTube from Botswana.
Wow!
Wow, that's really amazing. Yeah, fantastic.
Thank you. Okay. All right, another question coming from Mr. Romel. If the radio was last done 10 months ago, patient still has low WBC and RBC, will PPARS still be helpful?
Yes. It's been 10 months and your blood counts are still low.
That's alarming, right?
That is it's alarming.
It's cause for concern.
Yeah. You have to go for a consult. I have to know your history to give you the proper protocol. But depending on how low your blood cell count is, you have to go for a consult because if your blood cell count is really so low already, you might need 1 blood transfusion. Number 2, injectables. You can stimulate the growth of the red blood cells or the white blood cells, and have the proper support, Simply Nature PPARS. But yeah, again, it really depends on how low your count is. So yeah, you have to go for a consult. It's been 10 months. That's quite long. You should have been recovered already.
And you know why this is important is because, you know, we meet so many cancer patients who are successful in their first fight against cancer. They were declared cancer markers are normalized. They were very much celebrating, and then a year later, some are even less than a year, 6 months. Many are a year and a half, and suddenly there's a recurrence, right? And it's not that you did not do the fight against cancer correctly. You did, but you didn't do enough. Just as this case, if after the successful fight against cancer, your immune system, and the basic indicator is your red blood cells, white blood cell counts, if these are not strong, you are like a city without walls, right? As we all know, when you do your diagnostics and it says that your cancer markers are normal, it means that it doesn't mean that you're cancer free. It means that no cancer is detected. That fine play of words is very different.
Yeah.
All right.
Yes,
You know, when the doctor when the diagnostic the radiologist or the technician makes the comment there that this cancer is not detected, it doesn't mean it's not there. It means it's not detected, right? So that's the reason why many cancer patients get surprised, because they interpret cancer not being detected as cancer not being there. All right, and that's not true. So even healthy people like Dr. Jansen and myself, every day there are cancer cells in our body.
Cells, yes.
We have cancer cells, but our immune system is able to deal with it. So it's not that the cancer cells are not there, it's that we are able to deal with it, right? So we've got to make sure that your red blood cell count, white blood cell count, all these things normalize after your successful cancer treatment. So I think that's important advice for every person that is fighting cancer now, and those who have family members, to remember that once you fight the first fight, it's just the beginning. You've got to make sure everything normalizes so that you have a very little chance of recurrence. You know, Doc, it's quite telling. Many people don't realize this, and it happens that many people do get recurrence. Do you know why I know this? Because in Singapore, the insurance covers you minimum 2 occurrences of cancer.
Oh.
So that means the insurance companies assume that if you get cancer once, you will get it at least one more time. So the better plans cover you for three recurrences.
Oh, okay.
The standard plan covers you for 2. So this means that a lot of people, when they fight cancer, they thought that, you know, when your cancer markers are normal, hooray, and then they relax. Well, not done yet. That's where Dr. Jansen really comes in, and that's really where he shines. You know, making sure that your body goes back strong, and that's why it's really good to have a consult with a lifestyle medicine doctor like Dr. Jansen, who specializes in cancer, so that while you're undergoing your treatments, you're already protecting yourself, so that the second part is easier.
Thank you, sir. Actually, sir, this is what we are, this risk and matters are what we are focusing, because each phase of the chemotherapy or radiation therapy has their own goals. And once you have started the treatment, you really have to stick on the schedules.
Yes, you have to stick on the schedule. No matter how weak you get, right? Sometimes, because Dominic went through so many, Sheila's son went through so many, and at times you were worried.
Yeah, and that was the problem of our the last question that we had tonight, and that's how PPARS helps actually. It's to keep you on track with your schedule for you to be able to finish your treatments right away.
And of course, on top of the PPAR protocol, what you eat and exercise, all this is important, and Doc Jansen will go through that with you during your consult.
Thank you, sir. Thank you, Doc. All right, another question coming from Ms. Kogang Chin. If having this signs and symptoms for cervical cancer, can a patient still get the vaccine? I'm not sure if she's talking about the
That means, is
COVID
it too
vaccine or the cervical.
If you are infected already, is it too late?
Yeah.
If you are infected already, yes, it might be too late. Yes. So the cervical cancer, the HPV vaccine is best to have when you are not yet infected with the HPV virus. No. If you don't have cancer yet, okay, you don't have cancer, you don't have the warts, because you can also have warts because of the same virus. Okay, it's just a different strain. So it's best to get it when you are still perfectly healthy. But by the time you already have cancer, it might already be too late.
So for the patient who asked this question, this is your action plan. Number one, give yourself peace of mind. Just quickly go and see a doctor. All right, and because cervical cancer, like all cancers, when you catch it early, your chances of success is way higher. You saw in the slides earlier, Doc Jansen was showing the survival rates at different stages, right? So your action plan right now is go and see a doctor to get it checked out. And if it's good news, which is no, it's not cancer, maybe it's yeast infection or something, all right, then you go for your vaccine because the risk that you might get it based on your lifestyle is still there. All right, so that's the two-step action plan for you, and I hope that gives you direction and gives you peace of mind. Yeah.
Thank you. I see a question here coming from Ms. Lucelle. Can I ask a question, Doc?
Yeah,
yes, you
sure.
can.
Ask
Please type in
anything.
your question.
You can ask if Doc Jansen is single or not. He's not.
Okay. Another question coming from Ms. Lorelie Sarmiento. Can PPAR treat spondylolisthesis patient?
No. Spondylolisthesis is a problem in your spine. The problem is anatomic. So the solution is anatomic, which is surgery. Okay? PPARS cannot do anything about it. But there's a big but here. Okay? If the reason why you have spondylolisthesis is because you are too heavy, then yes, okay, PPARS can actually help you because PPARS can help you lose weight. Okay? But of course, don't just rely on Simply Nature PPARS. Okay? You have to do your part. You have to change your diet, okay, in order to lose weight. Okay? I think it would be better if I can talk to you personally, no? So go for a consult so I can see how can we help you, okay, to address your spondylolisthesis, because one of the crucial factors to prevent further worsening of that is to decompress your spine. So if you are quite heavy, then you have to lose weight, okay? And we can help you with your weight loss journey. But if not, okay, then the answer is surgery or physical therapy. Okay?
Thank you, Doc. Thank you.
And just
Sir, would you like to add? Yes.
Yeah, just for everyone, since we have viewers from Botswana and Zambia, because the consults are done over teleconsult, so it doesn't matter where you are in the world watching this program, you can ask Doc Jansen personal questions, all right? So you can arrange for a one-on-one teleconsult with Doc Jansen, okay? So don't worry, no matter where you are. And that means you might have a loved one that's working in Kuwait, in Russia even, and you want them to be able to have a consult with Doc Jansen. Yes, invite them to watch the program, and when they are comfortable, they can always arrange for a teleconsult with Doc Jansen.
Oh, by the way, can we share screen here while we are live? Share my screen?
I don't know.
Is
yes,
it possible?
The answer is yes.
Okay. I'll give you another. Let's just have our
You want to share screen
Yeah,
now?
yes. Now,
While
share
you are
screen.
doing that, Doc, I'd like to invite everyone because for those who want to have a consult with Doc Jansen, Simply Healed is actually trying to improve their processes, and we are making it very easy for you to schedule a consult with Doc Jansen. So the link where you can schedule an appointment, all right, with Doc Jansen is actually on the pinned comment, all right, here in our webinar. So please check that out. Right?
Okay, for the person who asked about spondylolisthesis, and for everyone's information, what is spondylolisthesis? I'll show you what it looks like. Okay?
Wow, so Doc is actually showing you guys how you can do research.
Okay, spondylolisthesis. It is not a simple,
Is this showing on the screen?
No, you should share.
Okay, click here.
Okay, let me find my. Let me take a look at my resources first, okay? Before I share my screen, I'll show you what it looks like. So, why is this so painful?
Would you like to go to the next question first and then?
Yeah, sure.
Yes.
I will take the next question.
Yeah, well, I am searching for a good image.
Alright. Okay. Another question: can it also treat breast cancer?
Oh yes, Simply Nature PPARS series, yes, definitely can be used to treat breast cancer. Okay, with breast cancer, there are many proven chemotherapy drugs as well. So I would really advise you to go for a consult with Doc Jansen, and so that you can find the best combination for you, because there are different types of breast cancer, and for some types the tailored chemotherapy drugs and even immunotherapy drugs are available, right? So just to keep your options open. But yes, Simply Nature PPARS is very effective for breast cancer, especially the early stages, all right? So for the proper dosaging, again, go for a consult with Dr. Jansen so that he can advise you. If you are in the late stages, be prepared that you will probably be using liquid extracts. But at the same time, because of late stages, Dr. Jansen will probably also recommend you to go and proceed with your chemotherapy so that you can quickly bring the breast cancer under control, and Simply Nature PPARS will be there to support that process and to also boost your own immune system to fight the cancer. So it's attacking the cancer from many angles, using all the best options available. All right, and of course your daily diets will also be adjusted so that it will be hard or make it harder for the cancer to grow. Okay, so for example, if you're having a cough and you eat fried chicken and chocolates, it's just going to make your cough worse, right? It's very easy to understand. So the same thing has to be done for cancer as well. And a lot of cancer patients face this dilemma, because many times when they're undergoing therapy, their doctors will tell them to not eat a lot of things, like not take supplements. And while Doc Jansen is looking for the image, I just want to take the opportunity to share with you why your onco will tell you not to take supplements. Okay, because every day there's a new supplement coming out in the market, right? Direct selling, network marketing, even all forms of supplements keep coming up. Now your doctor is so busy, if you just look at the queue that you wait every time you go and see your doctor, they're not going to have time, they'll be very tired, and of course they might not have the expertise to go and judge whether this supplement is going to help you or whether this supplement is BS, that it's all fake and it's going to harm you. So that's why doctors in general will then tell you don't take any supplements, because they can't guarantee that it won't have contraindications, that it's not bad for your cancer. Okay, so, which is again the reason why at Simply Nature we actually test our PPARS series with chemotherapy drugs, just to make sure that there is no contraindication, even though in theory it wouldn't have. But in practical testing, it doesn't have any contraindication. So that all our viewers and patients can be assured, all right, that it's safe, that it works, that it won't counteract together with any therapy your onco will give you. All
Okay.
right, are we ready?
Yeah, we're ready. Okay, let me show you.
Alright.
Okay, first to know what spondylolisthesis is,
Share.
we have to know what
Share screen?
we have to know
Oh,
what a normal spine looks like. Okay, so this is what a
Okay.
normal spine looks like. Okay,
There you
so
go.
here, focus on image A. Okay, here. Now, take a look at this. Okay, this is your lumbar spine. Now, normally, that is arranged in sequence. Okay, so you see, every segment, okay, supports the one that is on top of it. Okay, and you have this line. Okay, this dotted line. You notice that there is a very smooth curvature. Okay, this curvature is what we call in medicine as a lumbar curve. Okay, or lordosis. Now let me show you what spondylolisthesis is. Remember the curvature that I showed you in the first image? So take a look at image A. You see this one?
yeah.
You see the segments of the spine? You see one segment that is either
Ouch. Looks painful.
more posterior or more anterior relatively to the one on top. This is painful.
Very painful.
Okay? So take a note here. In this spine segment, okay? This is actually more posterior, or the one on top is actually more anterior, okay? Or situated more in front relative to the other spine segments. Okay? This is what spondylolisthesis means. Okay? Now, how do you correct this? Number one, you correct this with surgery. Okay? Number two, how do you reduce the pain? You have to lose weight. Okay? But losing weight is not enough. Okay? This has to be corrected through physical therapy as well. Okay? Okay, I hope you understand what spondylolisthesis
Wow, that's
means.
interesting.
Okay?
There's something new on our program.
Yes.
Yeah, that's,
I learned
that's pretty
something.
fun, right? Yeah, it's pretty
Okay.
fun. So I think our regular viewers, after watching a while, you will become like medical consultants yourself. This is watching like, those who watch CSI start to believe they are detectives, right? So
Detectives,
those who
okay.
watch Simply Healed program, after a while, you will start to believe that you're a doctor. All right. Okay.
Okay. Thanks, Doc Jansen.
Okay.
Something new today. Thank you. Okay, another question. Someone just really, I guess she just really wants to hear it again. Can PPARS treat PCOS?
Yes. It can. It can be reversed. I've seen a lot of patients already, but other colleagues of mine are also reporting the same things. Okay, lifestyle medicine doctors as well. Okay, PCOS can be reversed through lifestyle change, diet, exercise. It's possible. Okay. Yeah.
It's possible for them to conceive, right?
Yes,
Yes.
you can actually even conceive. I think Simply Nature Peepers have already a lot of stories about this.
Yeah, there are a lot of stories about conception because I have a friend who only has menses 3 times a year.
Wow.
Wow, but
That's quite-
so they were married for 10 years, they couldn't have kids, but today they are very, very tired parents of 4 kids.
Wow.
All right, so
Okay.
that goes. So basically, if you want to conceive, and you are young, that means you should be able to conceive, but you're not able to. Then it's because your body's health is not right. So in conceiving a child, there is multiple steps. Now there is even the consideration. Parents they don't start trying to conceive until they do something first, because there's actually this understanding that you can do a lifestyle change and you can improve the quality of your sperm and egg.
Yes.
Right? So you do know, right, that if you start with good ingredients, you end up with a great dish. So if your sperm is weak and damaged, then there's a chance that your kid is not going to be as perfect as possible. So if you really want to conceive, you want to have kids, entertain or think about it. why don't you get yourself really healthy? Your sperm will be healthy, your eggs will be healthier. And when you do conceive, your kid will have the better DNA.
Yes,
right?
yes,
and
yes,
develop
yes.
properly.
Absolutely correct.
So there is pre-conception things that you can do. Then there is things that you can take while your wife is pregnant and feeding the baby from her own body, and things that you do the moment your baby gives birth, right? So now it's a three phases. So if you have not conceived yet, you can actually start on improving the quality of your child by right now, before you even try to conceive, improve your own health.
That is very encouraging. Alright. I just want to greet the person who texted me. She said that she's watching. Hi, Miss Sylvia Ilagan.
Hello.
And of course, to our VIP, Miss Judy Jude. Hello, good evening. Thank you for watching us tonight. Okay, another question from Miss Lucelle Francisco, the one who said if she can ask question. Okay, I just heard I heard about something about live placenta capsule. Does it really help treating cancer?
There are a lot of those products out there in the market. I haven't seen any research about it that it really helps. But if the placenta that they are marketing about and the placenta that I have in mind is the same, then I don't think it would work, because placenta is, in fact, an animal protein. Okay, and animal protein can increase, it can stimulate the growth of cancer. So I wouldn't. And besides, there are a lot of ethical questions surrounding placenta harvesting. How did they get the placenta in the first place? Is it human placenta? Is it what animal species placenta? Okay, so these things you have to ask, and you have to do your research. But
Doc, this is an interesting question. I really like to hear from you. Maybe you share with us, what is placenta and why is it theoretically something precious? Is it something of value at all? Because when a baby is born, nowadays you get the option to keep the cord stem cells, so maybe you give us some, so that we understand what's the theory behind why placenta is good.
Okay. The placenta is, in Filipino, it's called inunan. Okay, so the placenta is the connection between the baby inside the womb and the mother's body. Okay, so it doesn't necessarily mean that if the baby is inside the mother's body, then they are connected. Okay, no. Their connection should be, there should be a placenta in order to connect the fetal circulation, the fetal blood circulation, and the maternal blood circulation.
So what is placenta?
Yeah, it's basically a connection between the baby and the mother. It's just that. It delivers nutrients from the mother to the baby. So the conduit is the placenta. Now, why is it precious? Because in the hospital, we just throw that away.
Oh, in the hospital, you just throw that away?
If the patient did not request to keep the placenta, then the hospital will throw it away.
Okay. Why would a patient think of keeping placenta?
There are a lot of superstitions about this.
But medically speaking, what value does placenta have?
None at all. Well, they recently found out that they can harvest stem cells from the placenta. But the stem cells, of course, when you do harvest, there will be ethical questions, ethical issues surrounding that. But nevertheless, since if the hospital is just throwing it away, why can't you, do the harvesting? The clinical studies haven't really been done well, but the theory behind, there are already benefits surrounding, because you can harvest the stem cells from that, and from the stem cells you can actually grow any cells you want.
Yeah, but that is a whole different, that goes into organ replication.
Yes, science fiction.
Yeah. So it's not so much that you eat placenta and it.
No. If you eat it, then your body will digest it. Okay, that will be broken down to individual protein. The protein will be broken down to amino acids. Okay, that's about it. Okay. For the benefits, I really don't know of any that is already well established. Okay, but so far, my patients who have took placentas.
Oh, you have patients that have taken placenta
Yes,
supplements.
they've got worse. There was one breast cancer patient of mine who took placenta. The breast cancer actually grew so much in a very short period of time. She got worse. I haven't had any follow-ups with the patient anymore, but that is one of my experiences with this.
So again, for the viewer that asked, I guess now you have a basic understanding of what placenta is. Well, you have to always check whatever the presentation that you were shown. You have to go in Google and check it out. But if you really don't understand, maybe you can ask for a consult with Doc Jansen, show him the actual product that you are interested in taking, and maybe he can give you some fair comments about it. All right. Now, I want to say to everyone out there, there is many supplements out there like Lingzi, ginseng, deer antelope placenta, and things like that. You will notice that even at Simply Nature here, even though we have published medical journals that show that our product works to reverse and cause cancer cells to die, even though we have all this evidence, scientific, published in medical journals, we still believe in taking the combination of all the proven methods together with our protocols. All right. So what I'm trying to say is, don't put your hope onto something that is like a long shot. Okay. Make sure that you explore all the established options first. And I guess if you've done everything and it didn't work, then no harm trying anything under the sun. But while your body is still strong and healthy, why not go for things that have been proven? Yes, we've talked about on our program many times, we know why you're afraid of chemotherapy, but that's only because you don't know how to protect yourself against the side effects of chemotherapy. But together with Doc Jansen, we can help you protect yourself against the side effects of chemotherapy, which means all these chemotherapy, radiation therapy becomes one of the most powerful tools you can have in fighting cancer. Because what's dangerous about them is already managed, all right? And of course, those who really want to go natural all the way, have a consult with Doc Jansen to see if that option is truly the best option for you. Many of our patients who want to go natural, they end up with initial phase of chemo and radiation, and then after that they go natural. So you gotta still slow the cancer down, make sure that you're in the stage where natural will work. All right, because if the cancer is very aggressive, going natural, you may not have enough time, and the potency of natural supplements is different from the potency of a toxic chemotherapy drug, right? Obviously, you can see how powerful the chemotherapy drug is because it also kills the healthy cells. But again, here we are able to help you manage the side effects, so it makes it a very effective tool for your fight against cancer. I hope that helps everybody, and I hope that helps the person who asked about the placenta. I would definitely get someone like Dr. Jansen who is open and well-read to give you comments. But don't put your first hope on something like that, right? Put your first hope on things that are real and proven and given track records for hundreds of thousands of cancer patients all over the world.
Thank you, Sir Sean. Thank you, Doc. That was actually a very good question, and I'd like to say that Sir Sean and of course Dr. Jansen has been very honest in answering these questions, even to the point that, of course, we always say here that PPARS is no contraindication with other medication, or if it's okay, so it's good to go with that medication. So there you go. Okay, another question coming from Ms. Chen Sinsago. Can this PPAR extract liquid help to a patient with endometrial cancer stage 4?
Yes again. Okay, for endometrial cancer stage 4, I think your onco would already be recommending you to receive either immunotherapy, chemotherapy, or radiation therapy. Probably not radiation therapy, but either immunotherapy or chemotherapy. Especially if you are on chemotherapy, then it would be really good if you combine that with a Simply Nature PPAR liquid. Okay? Yeah. Also with immunotherapy, it will make the immunotherapy drug more effective. Okay, so definitely yes.
Okay, thanks. Once again, thanks for your questions. We get a lot of questions coming from our Facebook team. I just want to let you know that we are also simulcast and live also on our YouTube channel. So for our YouTube viewers, you can ask questions too, okay? Alright, don't be shy, okay? Alright. Another question. Oh, this time another person is asking, Miss Janice, is it okay to take barley grass if you have those symptoms for cervical cancer?
Yeah, of course. Yeah, barley grass is food, right? So I mean, by all means, go and drink or eat.
Yeah, high in chlorophyll.
Yes.
That's good for you. It's a green superfood.
Right.
So go ahead. Go ahead.
Thank you. All right. Another question. Okay, will I need another test before we can decide on the treatment? This is for cervical cancer.
Depends on what tests you have already underwent. But before you start the treatment, I mean chemotherapy, radiation therapy, then yes, you would have to undergo a series of tests first. Number one, complete blood count. We have to know the status of your blood counts before you undergo the chemo and the radiation therapy. Number two, imaging. Imaging is very important, especially if you have your previous imaging, months before already. I mean, 6 months before, then that would be too old already. You have to have a recent one. These are all for baseline. For baseline test, meaning we have it's for us to have a comparison once you have finished the treatment. Okay, so yes, definitely. But for Simply Nature PPARS liquid and the extracts, usually I don't request for tests anymore because they're food anyway. You can immediately start. But if you haven't had tests, or the tests have been too old already, I mean you have had it once before, then I will. Okay, so yeah.
The guideline for having diagnostic tests is when you want to make a decision.
Yes.
All right. So we don't take tests for nothing. So we take tests because we want to make a decision. So if you're going to take a new protocol or treatment like radiation therapy, chemotherapy that has harmful side effects, you want to make sure that you check everything. That is why. Now, when you want to take Simply Nature protocols or do lifestyle adjustments that Doc Jansen will recommend to you, these don't need tests because it won't change your protocol. It will be something you would do anyway. However, as Doc Jansen said, if your previous tests are months old, I think as responsible doctor, Doc Jansen will want to know how you're doing right now, so that he can really know a month later whether the improvement is an improvement.
Yes.
He has a clear idea where you were, so that he can measure your improvement. So I hope that helps to understand why and when do we require diagnostics and why do we require the diagnostics.
Thank you, sir. Thank you, Doc. All right, another question coming from Ms. Jen. Can cervical cancer affect pregnancy?
In terms of getting pregnant, yes, because there's something that's blocking the path of the sperm going up. But if you have already conceived, yes, it can also affect the pregnancy because if the baby is growing, you can experience bleeding as well. Number two, while the baby is growing, it can put pressure on the tumor. It can hurt. So yes, it can affect the pregnancy, and because there is something there growing as well, the hormonal changes that your body is undergoing might also affect the growth. It might accelerate the growth of the tumor because during pregnancy, there are actually changes in the cervix that happens.
Wow.
Okay, now if you have cervical cancer, that means the structure of or the architecture of your cervix will be destroyed already. Okay, so yes, it can affect the pregnancy, but will it affect the growth of the child, the health of the child? No, it won't. It won't.
Oh, okay, that's good news.
Yes.
You know, Doc, now that you talk about this and the question about pregnancy, you know, I remember we had a patient who had a brain tumor. And you know, brain tumors we can't operate, right? So we can't do, and the doctors were very reluctant to give her any type of drugs as well because she was pregnant. So that was a really difficult situation because you can't give drugs for fear of affecting the fetus, and yet the patient needs to be treated. So guess what? In that case, the patient actually opted for Simply Nature liquid extract and powder extracts, and lo and behold, her tumors didn't grow during the whole pregnancy.
Oh, that's good.
That's good news. Okay, it didn't just disappear, but it was arrested. It didn't get worse. She had her baby.
Good.
All right, and then after that, she carried on with her the chemo and all the other treatments, and together with Simply Nature PPARS, and it was really good news because she sent me a picture when the baby was 1 year old. So both mom and kid are fine. Yeah. So you know, just to give you there are sometimes in certain circumstances like pregnancy, even if you want to use chemo, you can't. Because it will affect the baby. So that's when all natural becomes like the only option. Right? So if in those cases, Simply Nature PPAR extracts are like one of the best things you can do for yourself and your baby.
Thank you. Thank you, Sir Sean. Thanks for sharing that. I'm sure that, you know, a lot of our registrants and viewers tonight, that's one of their concerns would be the conception, having this cervical vaccine topic. Okay, thank you. Another question coming from Ms. Anair. I always suffer from spotting in between my periods, and sometimes I have spotting for a day, and then after that I don't have period anymore. Is that a symptom?
It can be. You have to get examined. Okay, but the source of the bleeding can come from the cervix. It can also come from the uterus itself, the endometrium. Okay, if the lining of the uterus, the inner lining of the uterus is so thick, it can produce that kind of bleeding. Okay, endometriosis as well. Yeah. Okay, myomas as well can produce that kind of bleeding. So you have to get examined.
As a tip to the viewer, you know, when I go and see doctors, sometimes, you know, I literally ask them, Doc, I suspect I have cancer, you know, and the doctor often, while they're doing a scan, they will smile, sir, no worries, it's not that, all right, because I'm nearing 50 and I had some urinary tract infection. And you know, I do all these cancer talks all the time. So this thing always pops out in my head, you know.
Is this it?
Yeah, and for me it's I'm not afraid of the cancer because we have Simply Nature PPARS and I understand everything. I just want to know if it is so that I can, as Doc Jansen says, treat it as quickly as possible, and my chance of success is going to be like near 100%, right? And if I delay, if I hide my head under the sand and think that it will go away, you know, then it might, what if it really is that, and then something that I could have easily handled because I have unlimited Simply Nature liquid extract at my disposal, I didn't use it, right? So here is the thing. I actually, when I did my prostate scan, I actually asked the person who was scanning, so it's not prostate cancer? No sir, no, your prostate is absolutely fine.
Absolutely good.
So I'm just sharing with any patient out there, don't be shy. Here's a tip while Doc Jansen's beside me. You know, you're the one paying your doctor, right? So don't be afraid of your doctor. All right, you're the client. So ask the question that's in your heart, and your doctor will either will give you the peace of mind. All right, yeah. So don't be afraid to ask directly. Okay, yeah.
That is really something that I learned from you, Sir Sean. When my son has his ongoing chemotherapy
really?
back then. I was really asking questions to my doctor.
Was your doctor
Really helped.
like,
Really helped.
really help, right? Instead of just keeping quiet and wondering, and and you're thinking, if the doctor doesn't say it's bad, means it's not bad. But when you go home, oh no, why didn't I ask? I'm still wondering if it really is, right? Yeah. Okay.
It did help. Okay. Another question. We have a returning viewer. I remember Mr. Davey husband was watching like few weeks ago.
Oh, okay. Welcome back.
No, the question that he has is how about welcome back and thanks for watching again. Right. What about stomach cancer? What are the signs and symptoms of stomach cancer?
Wow. It's weird. Stomach cancer gets asked in the cervical cancer webinar, but
It's Ask Me Anything.
It's Ask Me Anything. So okay, for stomach cancer, I think we have to have a separate webinar for this. But to answer you, some of the symptoms of stomach cancer, it's actually very non-specific. It can manifest as hyperacidity, discomfort in the stomach, bloatedness. But if you vomit, there's blood. And the color of the vomit is coffee ground.
Oh, that means it's like closer to dark brown.
Yes. Why is it coffee ground? Okay, colored like coffee ground. It's because the bleeding, of course, you bleed, right? There's an ulceration or there's a tumor in your stomach that is bleeding. Now, the stomach acids will try to digest the blood. Okay? So once it reacts with the blood, it turns dark. So when you vomit, that is the color, coffee ground color.
Oh, okay.
Okay? That is also a way to know where the bleeding is coming from. Because you can also manifest, one of the symptoms of stomach cancer is also coughing, incessant coughing. You are coughing until you vomit. Okay? But if you are coughing, then you have, the question is, why are you coughing? Is it because of the lungs or is it because of the stomach? Okay? Now, once you cough up, bright red,
then it's the lungs.
Lungs comes from the respiratory system. That is lung cancer. Probably lung cancer. Okay? But if once you vomit, the color is coffee ground, then it's from the stomach. Okay? Similar symptoms can also come from long-term aspirin use. If you have been an aspirin user for a very long period of time, probably years, so one of the side effects, long-term side effects of aspirin is actually gastric ulcer or stomach ulcer. So the ulcer can bleed, and once it bleeds and you vomit, then it has the same color. Okay?
So like in the diagnosing of cancer is not one symptom, but always
it's a myriad combination of symptoms depending on the history, when did it start, how often, is it persistent, where are there triggers. So these things has to be asked for your doctor to have a diagnosis. Okay?
Okay. I think last question, and I spotted one that was important because it's the timing is amazing. Because this Zainab Obie. Yeah, he asked if a mother that's been diagnosed with breast cancer, can she do breastfeeding?
Oh, very good question. I think it would be best if you breastfeed on the breast that doesn't have the tumor.
But what if both breasts?
If both breasts has the tumor, I think it would be really very uncomfortable because it can be painful. Right. Yeah, but nevertheless, you have to express the breast milk out, or else there might be clogging.
Build up, clogging, right?
Yeah, clogging. If the milk ducts gets clogged, then that can be another source of infection.
Yeah, that's dangerous.
If you develop mastitis, that is really very, very painful. Okay, and you need to have antibiotics. But okay, if the tumor is small, then yes, you can breastfeed.
I think that the question that people have in their mind, right, is they think like cancer is like some sort of like a rot. So I think that the question in the patient's mind and the husband's mind is, will this like rot the cancer, like spill over to the milk and make the milk bad?
Can.
Oh, it can.
Yes.
Wow.
But
I didn't expect that answer, but
Yeah.
okay.
That is when that happens, I don't think you will be at the point that you can breastfeed.
Okay.
Because although it can happen, there are certain breast cancers that can rot from the inside out. Okay, so actually some breast cancers even can develop pus.
Yes, that even breaks on the surface of the skin. So obviously the pus can mix with milk.
Yeah, it can mix with milk, but I don't think you will don't feed it to your baby. Okay,
Yeah.
because number one, the milk will have blood, the milk will have pus. Number three, it will be foul smelling as well.
Oh wow.
And it will really be very uncomfortable for you to breastfeed on that breast, because it will also be very painful. Okay?
So, action plan. Continue to pump the milk out so that there is no build up of milk in the breast, and that risks infection. And your wife already has breast cancer. You don't want an infection. Next, on the safe side, no need to feed your child a breast milk. In fact, I don't know, if you are Filipino, then I've experienced my friends here, amazing, because my friend had a triplet, and she made a call out for help, and there were like a dozen moms who supplied her with milk. So what I'm just saying is that I'm amazed in Philippines, the community here, people are so warm and so there's a strong community spirit. So if you belong to a church, just let your church know. I mean, that's what my friend did. She belongs to a huge church. Next thing she knows, she has like many moms supplying her, because having triplets, you can't produce enough milk for 3 babies.
That's
so
correct.
it was a beautiful thing to see the community come together and support the mother.
And also, there are certain moms who have so much breast milk, they don't know what to do with it. So instead of just flushing it down the toilet, might as well donate it.
Yes.
I mean, and of course, if moms are doing this, the milk will be well preserved as well.
Yeah.
Kept refrigerated, then they send it to you.
Now you have a grab. You just grab
it's
the
easy,
milk,
it's
right?
easy. So don't be afraid to ask for help.
Yeah, don't be afraid to ask for help. Reach out to your friends and relatives. I know it can be a bit shy, like looking for breast milk, Yeah, but go ahead, because breast milk is still the better choice for your kid rather than formula. Yeah. All right. That's the last question, right?
That's the last question.
All right.
Very good question.
Okay, Doc.
Are you up first?
I'll go first, then you close off tonight.
Yes,
okay, so I think tonight, thank you for everyone. We're so glad that every week our audience is building. So that's a great encouragement to Dr. Jansen and I, that we're really providing a service to everyone. As you can see, we've tried to keep our lecture segment short as possible so that we can answer more questions. And today we tried something new that we're going to do more, which is Doc Jansen and I will share with you our screen and help you see better, learn better. Okay, and we look forward to even more dynamic program as we continue. We continue to evolve and improve, and we just ask for your support. Please share with cancer patients and families who have people who have cancer, and please share the program, and we just want to thank you for your support. It's really encouraging and it makes it worthwhile.
Okay, thank you everyone for staying with us until 9 p.m. Okay, it's quite late already, but really thank you for staying with us. Without you, we won't be here. Okay, ask me anything won't be successful. Okay, so we are, for those of you who want to go for a consult, we are launching a registration page. Okay, so just go to the description, click on the link, then you will be directed to a calendar where you can book an appointment. Okay? So once you click on the calendar on the specific date, our healthcare specialist will reach out to you, then try to set an appointment for a consult. Okay? So you can go do that, or you can comment at the comment section. Okay? How to consult, I want to go for a consult, then our healthcare specialist will message you. Okay? So please try to look out at your messenger inbox as well, message request part of messenger if you're on Facebook. But if you are on YouTube, then it would be better for you to click on the link that is in the description. Okay? So yeah, thank you everyone who are watching from all around the world. Okay, from Africa, from Malaysia, from the rest of the Philippines. We have people watching from Palawan, from Iloilo, Northern Samar, Davao City.
Wow, all over, north
all
to
over,
south.
north to south. Yes.
you.
So thank you everyone. So please share this show of us to anyone you know who has cancer, so that we can help them. Yeah, that's it everyone. Thank you for staying with us until 9 p.m.
Thank you, Doc. Thank you, Sir Sean. All right, I just want to invite everybody for the next week's topic. We are discussing breast cancer, a glimpse to survival. Thank you.
Wow, okay.
For all the people, yes, for all of you who watched us tonight, thank you so much. And yes, please share us to your fellow patients, fellow relatives, and families, with people whom we could help as well. And your victories over cancer is really what keeps us going here in Simply Here and also Simply Nature. And because here in Simply Nature, we are always with you from start to healing. Thanks everyone, good night, and God bless you all. See you
God
again.
bless you.